incubation period. 1 week, 1 month, the situation can occur, and you might not even relate it to that nail puncture wound. So it must be properly managed.
Now, I usually hear that, if the nail is not rusty, don't bother. They ask, was the nail rusty? No, it wasn't rusty. Okay, that's all right.
Well, anything that is sharp, whether rusty or not, portends a danger for tetanus, because where it is on the floor in the first instance is carrying dirt where the organisms are there. So you can, even if it is not on the nail, inside the nail, you can carry it from the ground or the floor into that person. So you must bother. Any perforating injury requires exploration by the doctor.
Okay, but some people have a method they use which they say works. They heat up a knife or some other object and actually push it into that hole or around the hole and say it's burnt everything that could cause any problem.
In 1910, that was okay. Like people normally reduce fractures by forcing it, and the person is screaming. But in modern world, we have advanced further than that to be able to save you from the pain of a hot, sharp knife going into your body. There are injections that will be given to you to deaden that place, and the place is carefully opened up and explored and cleansed out and kept open.
And aerated.
Yes, aerated, and it heals. Okay. So it is better that way. The system that you've just described works, but it was in the past, and it's very, very crude.
Then it could be dangerous too.
It is dangerous because in the course of doing that, it can cut blood vessels. I might not be able to arrest them.
Okay. How about ingestion of things other than food? Kerosene, for example.
Chemicals.
Lots of people will tell you that kerosene just hanging around the kitchen, which you use for cooking, cannot hurt a child. Some of them claim this kerosene has even gotten into their soup when there's no light, and they're using a lantern to check, the state of the soup. Perchance the opening where the kerosene is put is open, and some pours into the soup. Is it dangerous? It
is dangerous. It depends also on the degree. Because if it's just a drop, you may just be perceiving the odor of the kerosene. Nothing might happen to you. It makes the food distasteful. But in certain quantities, depending also on the size of the person taking it, it is dangerous to take chemicals into the system. And we always must avoid or keep those things away from the reach of children. And we ourselves must keep it away from making mistakes.
Would this be the same category as medicine? Maybe a child takes an overdose of something. I know a child who took just cough mixture. It was just cough mixture. Yes. But he drank the whole bottle. And everybody was wondering, why is he sleeping so much? But I think he got over it.
Yeah. Cough mixture has some sedatives in them, so it will cause him to sleep, but actually can toxify the child and kill the child.
Okay.
So overdose of medications have to be avoided in a home. And the chemicals you are talking about are not edible. They are not to be taken by mouth, like kerosene, paints, and so forth. All those have to be kept out of reach of children, and adults must avoid them. It is possible for your house help, by mistake, to put something like bleach inside the bottle. If the bottle of the bleach has broken and he pours it into the drinking water bottle and then mistakenly puts it in the refrigerator, and somebody has actually made that mistake.
But why would someone put bleach in the refrigerator?
Because it was put in a drinking water bottle. Okay. So he thought that it was just like the other water there. So he puts it in the refrigerator. And then the owner of the house came, opened it, and before he knew it, he was drinking. He had taken 2 gulps. The odor had hit him on the face and realized he has taken this. And there was a problem.
What does he do?
Well, normally you have to get to the hospital to be helped. You don't try to drink other things except ordinary water to dilute it.
People try milk, water, and what have you.
Oil, they do all those things. But the easiest thing to do is water to dilute it. The safest thing to do. Don't add any other chemicals because you might not know which one will react adversely to your system.
So will I be right in saying water to dilute it and then straight to the hospital?
As you are drinking, you are going to the hospital. The first thing is head towards the hospital. Somebody will give you water on the way you drink, and then you go to the hospital because they need to dilute it and sometimes need to actually suck it out if it is still there in large quantity.
Now, I know that people have said, doctors usually tell people, and it's now almost common knowledge that when a woman is pregnant and her water breaks, it's time for her to go to the hospital. But what if the water doesn't actually break? It's just dripping.
It is still necessary to go to the hospital. See, the bag of the water and the water actually hold the baby in a safe environment and is relatively sterile for the baby. The moment it leaks, there's a break. So there's a chance of an infection coming in from outside onto the child.
Okay, so the trick is it mustn't even open.
It shouldn't break. If it's going to break, or once it breaks, then that's a sign of labor. It's the first sign of labor in women. Either you see a show, what we call a show is something like pinkish. It is some fluid mixed with blood. Once you see that, when you are pregnant and you are term, it's the first sign of labor. If the water breaks first, then it's also first sign. You have to get to the hospital. You need to report to
even when she hasn't reached term?
Well, if she hasn't reached term, it's even more dangerous. You must get to the doctor because that child is at risk of infection and might be destroyed, might be killed.
Could you tell us maybe one or two other things that might be an emergency for a pregnant woman?
Well, a pregnant woman, before delivery, bleeding of any sort is an emergency for the woman. And severe abdominal pain, when it is not term, is also an emergency. It could be an ectopic. In more advanced situation, it could also be abruptio placenta, causing a hardening of the uterus, and the baby might die. Bleeding after delivery in severe quantity. Normally about 400 mils of blood is lost at delivery.
Well, how would we quantify 400 mils of blood?
You don't have to quantify it. You go to the hospital. We don't have to quantify it. We quantify it there for you. It could be less. It could be a little bit more. But depending on the vital signs, whatever is found in the physical examination, the doctor or the nurses, midwives are very experienced people, know what is safe. But beyond that, after you've delivered, what you normally will be having will be liquor following that for a period before it dries up. But some people can actually start bleeding all over again.
And keep on bleeding.
These are postpartum hemorrhages. These are risky things in pregnancy. And if a woman vomits too much, it is a normal thing for many women to have nausea and vomiting in the early pregnancy. But some of them could be very, very severe, keeping them away from food for days, making them lose weight, and some of the vomiting can actually lead to eventual miscarriage. We call it hyperemesis gravidarum. Those are severe cases that a
doctor
woman must
should
get to see the doctor, yes.
Okay, so here's some bleeding for you. A nosebleed.
Nosebleed, epistaxis, it happens in people. Many different causes. In children particularly, sometimes it's due to picking the nose with long nails, sometimes putting foreign bodies in the nose, and some other cases in adults, it could be due to severe high blood pressure, other things. Bleeding abnormalities can occur that lead to it. Where it happens, normally you have to pinch your nose and breathe through your mouth as much as possible. If you do that for about 5 minutes or so and release, without making effort to go to clean out the blood clot, the bleeding might stop.
But if it doesn't
stop, you have to get to the hospital. We normally would put some things in the cotton wool or gauze, things like adrenaline, that will constrict the blood vessels and put it there and squeeze or pinch the nose again. It might stop it, but where a blood vessel actually has opened up, seriously, like in trauma, you fall and hit your nose, or in domestic abuse.
That one could translate to surgery, right?
Yes.
I'll have to take a break at this point.
Thank you.
We'll come back after now.
Thank you.
It's a break for us right now. When we come back, your questions, your comments, and perhaps you've experienced something we haven't spoken about in and around the home. After now.